The advantage of good nutrition with non-Hodgkin's lymphoma. Like other types of cancer, non-Hodgkin's lymphoma may have no symptoms to indicate its presence. It is usually diagnosed only after a number of other diseases and conditions are tested and subsequently ruled out. Testing is usually done by physical exam, which will include blood and urine tests and may include X-ray, CT scan, MRI or PET scan. As with other types of cancer, biopsies are typically done on suspicious lymph nodes to confirm the diagnosis. A secondary biopsy of the bone marrow may also be done to check for spread of the disease. After diagnosis is confirmed, it is classified and then staged. There are about 30 types of non-Hodgkin's lymphoma and stage A is considered to be the most treatable. Non-Hodgkin's lymphoma, a cancer that starts and develops in the lymph nodes, affects the immune system. There are certain conditions of the immune system that can increase the risk for developing this disease. Organ transplant patients are given an immunosuppressant drug, which can increase the risk of this type of cancer. Another risk factor is exposure to certain pesticides. Treatment will depend on the stage of the cancer as well as the size of the tumor. Options for treatment include surgery, chemotherapy and radiation. Other treatments can be considered for the cancer, including newer and experimental treatments, may also be used. Build a stronger immune system through a better diet. Non-Hodgkin's lymphoma, like other types of cancers, is a disease of opportunity. It is one that will attack the body where it is most vulnerable. If the immune system is at risk, the cancer will attack there. The best method of protecting the immune system is with a healthy and well-balanced diet. A good diet includes lean proteins, complex carbohydrates and healthy fats and should be discussed with a doctor or nutritionist. In addition to giving you the strength to fight this disease, eating frequent, small meals can help with the nausea that can be involved with a chemotherapy or other treatment plans for this cancer. Before making any major changes to the diet, the patient should talk to a nutritionist to discuss exact caloric needs and the right amount of protein, carbohydrates and fats. According to the American Heart Association, the diet should not be more than 35% protein. No matter how the diet is divided up, the nutrients must come from the healthiest sources. Whole foods are always the best choice. However, there are times when it is nearly impossible to eat a rich and healthy meal. In addition to getting protein from foods such as meats, dairy and grains, there are protein supplements that can be included in a healthy diet as well. A nutritionist or doctor may suggest some guidelines for a good supplement choice. Supplement options include protein shakes or powders, bars, puddings, enhanced waters and supplement shots. The doctor will typically set a limit for the sugar in the protein supplement that is used because sugar can severely hamper the immune system's function. ProfectR, the protein supplement from Protica, can be a better choice for a cancer patient as well as for others because in addition to the high protein content and low calorie count, there is no added sugar or fat. Another option from Protica is ProasisR, the first all-natural protein supplement. Both ProfectR and ProasisR give a full 25 grams of protein in a single serving shot that is less than 3 fluid ounces in size and can be consumed quickly. There are several sizes of ProfectR and ProasisR for convenience. Both are available in a number of flavors, which can make it easier to find the right one for the cancer patient who may be having serious problems with nausea. Another advantage of ProfectR for use by those who are facing serious conditions and diseases is the ability to blend it with other foods or beverages to change the flavor as needed. Both ProfectR and ProasisR are heat and cold stable and require no special handling for safety. Non-Hodgkin's lymphoma and diet, a case study. Diane has been having some minor, ongoing health problems that are not only difficult to bear, but have started to affect her entire life. In addition to a nagging cough that will not go away, she is losing weight. A co-worker scares her by talking about problems such as tuberculosis and other serious diseases. The co-worker reads information on websites, coming up with more questions to ask Diane. Finally, Diane goes to the doctor for testing. The doctor rules out a number of conditions, including tuberculosis. However, there is a troubling swollen lymph node that the doctor takes for biopsy. Diane is glad that she does not have tuberculosis but is horrified to learn that she does have non-Hodgkin's lymphoma. She is convinced that it is fatal. However, after confirmation and further testing, the doctor lists her at stage I, which he explains is very treatable. The doctor will start with chemotherapy and then move into radiation. At the end of the radiation cycle, the doctor will re-evaluate the size of the tumors to see if they need to be surgically removed or if they are gone. While she is enduring the treatment and getting herself back on the track for good health, Diane will be working on getting the good nutrition that will help her body fight off the cancer cells. In addition to including more whole grains, fruits and vegetables, Diane will be eating more protein, especially from leaner sources. Diane will also include ProfectR in her diet as a between-meal snack, helping her to keep her strength up and giving her the ability to fight this disease.